Influenza, commonly known as the flu, is a highly contagious respiratory illness caused by influenza viruses. It affects the nose, throat, and sometimes the lungs, leading to mild to severe symptoms. Influenza has been recorded for centuries, with major outbreaks such as the 1918 Spanish flu, the 1957 Asian flu, the 1968 Hong Kong flu, and the 2009 H1N1 pandemic. These pandemics have shaped public health responses worldwide. Knowing how influenza spreads, its symptoms, and how to prevent it can help individuals protect themselves and their communities. With proper awareness and timely medical intervention, serious complications can be avoided. Causes and transmission. There are 4 main types of influenza viruses. Influenza A is the most severe and is responsible for pandemics such as H1N1 and H3N2. Then we have Influenza B, which causes seasonal flu and is typically less severe than type A. Influenza C, on the other hand, causes mild respiratory illness and is not a major concern. Finally, Influenza D primarily affects cattle and is not known to infect humans. Influenza is transmitted through respiratory droplets from coughing, sneezing, or even talking. It can also spread by touching contaminated surfaces and then touching your face, especially your eyes, nose, or mouth. Close contact with infected individuals, particularly in crowded places, increases the risk of transmission. Certain groups are at higher risk of contracting influenza. These include young children and elderly individuals, pregnant women, people with weakened immune systems, and those with chronic illnesses such as asthma, diabetes, and heart disease. Symptoms and diagnosis. Common symptoms of influenza. Symptoms typically appear 1 to 4 days after exposure and include fever or chills, cough and sore throat, runny or stuffy nose, muscle aches and fatigue, headache, and shortness of breath. Severe and complicated cases. In some cases, the flu can lead to pneumonia, respiratory failure, worsening of chronic conditions, and sepsis. Influenza versus the common cold. Unlike a cold, influenza symptoms are sudden and more severe, with a higher likelihood of fever and body aches. How is influenza diagnosed? Rapid influenza diagnostic tests, or RI-DTs, provide quick results but may lack accuracy. Polymerase chain reaction, or PCR tests, are more reliable and widely used. Clinical evaluation is also important based on symptoms and medical history. Types and strains of influenza. Influenza viruses mutate frequently, leading to different strains each flu season. Influenza A is the most dangerous type, capable of causing pandemics. Notable strains include H1N1, also known as swine flu, and H3N2, known as Hong Kong flu. Influenza B is seasonal but significant and does not cause pandemics. It circulates in 2 lineages, Victoria and Yamagata. Influenza C is mild and uncommon, while Influenza D affects animals, not humans. Prevention and control. Flu vaccination, your best protection. Updated annually to match circulating strains. Recommended for everyone over 6 months old. Reduces severity even if infection occurs. Other preventive measures. Wash hands frequently. Cover your mouth when coughing or sneezing. Avoid close contact with sick individuals. Disinfect frequently touched surfaces. Antivirals like oseltamivir, also known as Tamiflu, and zanamivir or Relenza, help reduce symptoms and complications if taken early. Treatment and management of influenza involve a combination of rest, hydration, and medications to alleviate symptoms. Over-the-counter medications include fever reducers like acetaminophen and ibuprofen. Decongestants and cough suppressants can also be used to ease symptoms. Home remedies and supportive care are essential. Stay hydrated and get plenty of rest. Use humidifiers to ease breathing. And consume warm fluids like soup and tea. It's important to know when to seek medical attention: difficulty breathing, persistent chest pain, severe weakness or dehydration. Complications of influenza can be quite serious. Potential complications include pneumonia, which can be either viral or bacterial infections in the lungs. Sinus and ear infections are more common in children, and though rare, inflammation of the heart or brain can occur and is severe. Influenza in special populations. Certain groups require extra precautions. Children and infants, for instance, are at a higher risk of complications. The elderly have a weakened immune system, making them more susceptible. Pregnant women should also be cautious, as the flu can cause birth complications. And of course, immunocompromised individuals face a higher risk of severe illness. Seasonal versus pandemic influenza. Seasonal flu occurs yearly and usually brings mild to moderate illness. Pandemic flu, on the other hand, is rare but severe. It spreads globally and involves new virus strains, making it much more dangerous. Global impact and public health response. Organizations like the World Health Organization, or WHO, and the Centers for Disease Control and Prevention, or CDC, monitor flu activity and develop vaccines. Flu outbreaks cause workplace absenteeism and healthcare strain. Governments invest in public health preparedness. Myths and misconceptions about influenza. The flu shot gives you the flu. This is false. The vaccine contains inactive or weakened virus. Healthy people don't need the flu shot. This is also false. Anyone can get and spread the flu. Antibiotics treat the flu. This is false as well. The flu is viral, not bacterial. Conclusion and future perspectives. Influenza remains a significant health threat. Advances in mRNA flu vaccines are promising. Public awareness and vaccination are key to prevention. Final thoughts. Stay informed, stay healthy. If you found this guide helpful, make sure to subscribe for more health tips. Like this post to support the content. Comment below with your thoughts or questions. Share this with family and friends to help them stay protected from influenza. Your health matters. Let's spread awareness, not the flu.